Hello, my name's Lisa Gibbs and I'm a Professor of Public Health at the University of Melbourne in Australia. And it's a pleasure to be part of this series and particularly to be in the same session as my friend and colleague Siobhan O'Higgins and her young co-researchers. And I'm just disappointed that I can't be there at the same time or in the same place to do that. And I know that Siobhan and her co-researchers will provide amazing insights into really authentic child participatory research methods. And so I thought what I would do is instead talk about scaling up research projects and what does that look like when you increase the reach and impact at a national or even multinational level. So I'll share my screen so that you can see my slides. Let's see how we go with that. Okay, let's get started. And this first image that you can see are the young people who were part of the project Kids Contribute that I'm going to tell you about. Because I thought what I would do is start with an Australian case study of a scaled up project and how that extended into an international project, a multinational project, and then talk about a systematic review that we conducted and how the findings of that aligned with our own experiences and what are the implications. But before I do that, just for the sake of clarity, I just want to explain how I'm using some of these terms. And the term research participation for me is when children and young people are contributing data. So for example, they may be responding to a survey or part of a focus group discussion, whereas participatory methods is where they are actually contributing to decisions and the research methods. And so they are co-researchers. That's the difference as far as I'm concerned. I also wanted to provide some context and explain that we are fortunate in being able to collaborate regularly with our colleagues at ABC Behind the News. So ABC is our public broadcaster, television broadcaster, the equivalent to your BBC. And they have a children's television news program that's similar to Newsround. And it's actually used a lot in classrooms across Australia. The teachers use it to engage the children in discussions about current affairs. And there's a lot of interactive opportunities through the Behind the News website. And the great part about that is that when I'm talking about research that we've done with children across Australia through Behind the News, it means that the reach is quite equitable because it's reaching children through the classroom rather than relying on their families being ABC viewers. So the first study that I wanted to talk to you about is called Kids Contribute, and we were really fortunate to have 55 young people across Australia involved as co-researchers, and they ranged in age from 7 to 17 and very different contexts that, you know, some were in urban environments, some rural, some from privileged, comfortable, middle-class Australian circumstances, and others in precarious living circumstances or from refugee migrant background and so on. And what we did was we talked to them about their experiences contributing in their lives at home, in school, or in the community, and what that was like for them and how that influenced their sense of well-being and their resilience. And then they helped us to develop a survey so we could find out what other kids across Australia were experiencing. And Behind the News ran the story on that and created the opportunity for young people to contribute to a survey. And as you can see at the bottom of the screen here, we had almost 11,000 children and young people respond, which was fabulous. And the majority of those were between the ages of probably 9 to 13, but absolutely extended across the age ranges from, I think it was, 8 to 18. And we found out many things. This is really just a teaser. not surprisingly, almost all of the children and teenagers were contributing in some way in different contexts. But we did find that those who were contributing more were showing higher levels of resilience as well. And interestingly, what we hadn't anticipated was that girls tended to report that they were contributing more often and in different ways than boys. And where girls and boys were reporting that they received pocket money, boys were more likely to report that they received pocket money. And when they did receive pocket money, reporting a higher level of pocket money. And so those gendered results weren't anticipated and were received with great interest from our young female co-researchers. And that became one of the stories from this research, because our co-researchers worked with us to say what they felt were important messages coming through from the data and what they wanted to do with that, how they wanted to amplify that and give that context. And we supported that by providing an audience for them. We held a national child and youth forum with influential Australians in the panel, and it was co-hosted by our National Children's Commissioner and generated some media interest, but also the findings were included in the Commissioner's report to the United Nations on Australia's performance under the UN Convention on the Rights of the Child. So this all evolved over time. It wasn't what we'd kind of planned from the outset, but we were really pleased with how it all flowed and wondered if this could be a model for working with young people on different public health topics and topics that they identified. And so we applied for funding and actually were really excited when we got funding from our Vic Health organisation here in Victoria for what we called the Think Big project. And essentially that was to model what we had done working with young co-researchers using a digital platform to extend the reach and impact of that research with, an opportunity to contribute to debate about public health issues affecting young people. And we had collaborators who were also interested in doing that and joining us on the Think Big project, as you can see here. And we've actually just come to the end, or if you can call it an end, these things flow on, but the official end of Think Big is this month. And it's been really interesting because we anticipated that the project in the United Kingdom, being led by a colleague, Professor Rona Campbell in Bristol, we thought it would be similar to here because we were able to connect Rona from the ABC to the BBC. And there were some discussions there, but there really wasn't the right opportunity to engage in the same way through the BBC. But there was an opportunity to work with children and young people through a series of workshops to get their views on new legislation about compulsory sex and relationship education in schools. And that was paired with insights and perspectives from adults to contribute to thinking about how that might be rolled out and what sort of educational TV programs might support that. For our colleagues in Colombia, they were interested in how children and adolescents engage with the media, and were following a similar model with having a group of co-researchers and then extending that to seek further input. And they got great government support and interest about extending it from not just the metropolitan areas, but also to the children in rural areas. And not all of those children had access to digital platforms. And so they had to adapt their methods to be able to reach those children in different ways. And then because of the onset of COVID, the final stage of bringing the results back to their co-researchers was affected because they couldn't meet with their young co-researchers. And so unfortunately, that final stage relied on the adult researchers in interpreting the final results without that additional input. In Chile, it was quite a different scenario because they had an existing digital platform across schools as part of a health promotion initiative. And they were able to use that to engage with them, seeking young people's views on their rights and opportunities for participation in Chile. And that became really interesting during the period of political unrest and demonstrations in the streets and so on. And they had to progress very carefully because they wanted children's views, but they also had to be mindful of their safety needs. But they were able to create opportunities for children and teenagers to provide input into what they thought should be part of the new constitution that was being prepared by the Chilean government after this period. So that was a really amazing development that was not anticipated at the start of the Think Big project. In Victoria, in Australia, coming out of our first Kids Contribute study was interest from the young people about exploring the role of sports in promoting social inclusion for young people from a migrant or refugee background. And our researcher who was leading on that, Dana Young, wasn't able to get it started because during COVID restrictions, there was a ban on conducting research with children through schools. And so that was paused. And of course, the sports clubs were all closed as well. And then when things started to ease up here, Dana was on maternity leave. So that project had to be shelved. Our project in New South Wales also wasn't able to proceed. It was this amazing opportunity to look at intergenerational sharing of Aboriginal language and dance, but it didn't get through ethics. And this, of course, is a really common issue in the space of participatory research with children, that some ethics committees are not familiar with the process and not comfortable with it. But what we were able to do was have a new project that was engaging with children and teenagers about their views and contributions in relation to COVID-19. And we were once again able to partner with Behind the News to seek the views of children across Australia and bring that back for our co-researchers' interpretation. So it had been a really interesting process of responding to quite dramatic changes in both local and global contexts. And of course, at the same time that we were doing all of that, we were publishing this systematic review, and this was with colleagues in the US, and you can see them listed there. The focus of the review was also on how do you scale up youth-led participatory research using technology. And I'll go through this just in the briefest of ways to give you a sense of what was there. Firstly, there was hardly anything published. We found 9 articles from 5 studies. Those particular studies covered a range of public health topics. The scaling up ranged from into schools to a large national project. And they used different digital platforms. One even created their own digital platform, but the majority did use Facebook in some way. Now, the benefits obviously are that it increases the reach. Who can you include in these projects? It's always extended. And it does reduce the costs when you're thinking about the data entry costs of paper-based data collection or focus group discussions. Anything you're doing digitally, it's quite easy to collect that data and also to feed it back to participants and stakeholders. But some of the challenges that were coming through from these studies were really interesting and very consistent with what we experienced with our Think Big project and the Kids Contribute. And that was that it's quite difficult to create opportunities for communication across the sites involved in these scaled up studies, and particularly to enable meaningful decision making when children are engaging online and with other groups. So that really didn't work so well. So the information sharing worked well, the collecting data worked well, but the shared decision making across sites was difficult. And the organisational readiness and capacity to support that complexity was problematic. And of course, the other issue that came up with Think Big was that not everybody has access to digital platforms and not everybody has the literacy to engage with that. Another issue of concern for us in the review and in the work that we're doing is the integrity of the participatory methods. We found when we appraised the studies in the systematic review, they were pretty consistently using meaningful youth-adult collaboration at many, if not all, of the stages of the research. Very few were youth-led, but equally very few were purely adult-led. But the complexity of the multiple sites, as I've mentioned, was challenging. And one of the other issues is maintaining consistency in the underlying principles that are guiding what you do and the capacity and skills of the facilitators for that to take place. So just being confident that everybody understands the ethical elements, everybody understands the participatory elements and is consistent in how they apply that. The other thing we found, which is, not that unusual with child participatory research methods, is that you get different levels of interest and engagement across those that are included. And look, that's fine, as long as it's their choice as to the level that they engage. The question is, are they all having an equal opportunity to engage at the level that they would like to? Because what we found was that the sort of the go-to model is to have a smaller subgroup of adolescents who are engaged at quite a high level throughout the study, and others come and go and contribute in different ways. So I guess our takeaway thoughts in relation to this are that, as we all know, children and youth are already active online. It's not an unfamiliar space. So there's no reason why we can't, as researchers, engage with them in that space, particularly since there's just a much higher level of experience for everyone, given remote learning that's been happening for schooling. And as researchers, we can offer a safe and authentic research experience that is structured to influence change, as long as it's done in a very thoughtful and careful way. It's important to be aware and acknowledge that those most closely involved as young co-researchers are the ones who are likely to experience that empowerment that we associate with this research approach. And that those on the periphery are less likely to experience it in that way. But that doesn't mean it's not a positive experience, because they also have an opportunity to contribute and to be heard. And certainly we found that with our Kids Contribute survey through Behind the News, the comments that the research participants in the Kids Contribute survey posted on the Behind the News survey were absolutely positive. They loved the idea of being part of it, and they loved the idea that the questions were framed by other young people. And finally, if there's one thing we've all learned, is the importance of flexibility, because there can be quite dramatic changes happening locally and globally that we need to adapt to. And really, this sort of participatory method really lends itself to that. And so I think that indicates that it's a really positive method for us to use in these changing times. So I will leave you there, and I hope you have a fabulous opportunity to engage in some discussion as part of the session, and I hope to hear about it afterwards. Thank you.